So I designed my own website, and you can't really read that, sorry, but it says I'm a new kind of doctor. I mixed the internet with the old school type of physician. So what that meant was you can go to my site. In the middle there's a button that says make an appointment. That would bring up my Google Calendar. People could choose a time. They could include a photo of their symptoms if they really wanted to, and their address. And I would do a house call. And we'd follow up on Skype or what have you, and you'd pay me via PayPal. So the entire thing really costs about $1,500 to get started. I built all the technology myself. And I launched it in Williamsburg, Brooklyn, which is like sort of, you know, the capital of hipsterdom. And so it was relatively easy to sort of confine it to the neighborhood and you know, make house calls if I just, you know, kept it to 20 or 30 blocks or so. So that's how I kept it a little manageable for me. I did about 6 or 7 house calls a day. The media really got a hold of me. The first month was really fending off the media in so many ways. I had movie offers, book offers. I'm like, I haven't even done anything yet, guys. This is 2007, right? Gawker got a hold of it, if you guys follow Gawker. Anyway, I got about 7.5 million hits on my site in that first month. So it was almost an immediate practice. It was pretty interesting. That said a lot to me. That said that, you know, just the average consumer is ready and willing to engage if given the opportunity with healthcare professionals. So the industry started paying attention. I was on the cover of that Hospital and Health Network magazine, which I had no idea what that was at the time. But it really sort of, you know, helped my career take off in a big way. Based on that practice, I hooked up with a gentleman, and he said, you know, I think there's a company we can do out of this. So, you know, I thought, well, hey, yeah, I think this idea is pretty good. Let's see what we can do. So we ended up raising about $30 million, which is not a small effort, and built a company called Hello Health. So this was founded in early 2008. The best way to describe this is if Facebook could design an electronic medical record. So this was 2008. Pretty, you know, I think exceptional because it's about connecting you with your doctor in real time and also asynchronously via an application and also in person in their office. This wasn't really designed for doctors to do house calls anymore. So we launched Hello Health, and a couple thousand doctors are now using it across America, which is pretty cool. You can't really see what this is, but it's, you know, it looks a lot different than Epic. And this is 2008. So it was a real revolution, I think, in design and healthcare technology. Let's skip through this. From the patient side of things, the patients had profiles too. They could choose a time when they wanted to meet up with their doctor. They could manage their team of doctors, that sort of thing. We built in video conferencing, so people could video chat with their doctor. Keep in mind, all of this stuff happened after we met the person in the office. So you could video chat with your doctor after meeting them in their office. And that first year, we got about 2 requests to video chat. That really just told me a lot, too. It was more that people don't ever want to video chat with strangers. They do if it's with their granddaughter or wife or boyfriend or something like that. But professionally, I'm not a believer at all in that stuff. So in order to prove out that technology, though, we had to build a lab. So we built this practice in Williamsburg, Brooklyn. It was an old vintage clothing store. Did some redesigns, made it pretty, made it something that people wanted to go to. Hired some really wonderful doctors that you know, had nice smiley faces. And people that I think the community would resonate with. And then we had to announce that we existed, so we put up a lovely subway campaign in the Bedford Avenue subway stop in Williamsburg. And we did a good job, because it really engaged the community. And that's exactly what we wanted to do, right? If you get really close, you can see some really wonderful things. So this was up for about a week, and then the MTA contacted us and said, "Hey guys, you got to take this down." You know, we said, "Why?" "Well, it encourages graffiti." We're like, "Is this what does that mean?" And well, you know, it's censorship basically. So then we seeded that out to the news agencies in New York City, and we drove about 250,000 people to our site just because the MTA was censoring us. So it was a really good way to sort of get the word out that we exist. And that's when I learned you can sort of hack the media, which is pretty fun too. So we put up another more appropriate advertisement, and that's really what we were trying to do. Just take that old school massive healthcare delivery system and bring it to, just bring it simple, make it simple. So I worked at Hello Health for about 3 years and then decided to go do another thing. That other thing was a design firm called The Future Well. We had clients. It was founded with the head of innovation, ex-head of innovation at Humana. So he and I teamed up to basically help big brands understand what this whole internet thing is. So this is about 2010. We called it The Future Well. Our clients were the NHS in the UK, Planned Parenthood of America, in New York City, and Sanofi in Paris. So again, it's a crazy world. Never did I think that, just 2 years after graduating residency, I would be flying all over to Paris and London, helping big brands figure this stuff out. But one of the things that came out of that was I built an app for Physicians Interactive called Omnio. And Omnio became, I think, the second or third most popular iPad app for physicians. So that was the last design project we did. We created the concept and then built the technology. But really, what all of this stuff is just a realization that our culture has changed significantly, right? The internet laid down the pipes. This Facebook thing allowed us to use the pipes to connect to each other. And then the iPhone came along and put a little computer in our pocket, enabling us to do all this stuff. It works a little bit like magic, of course, like Uber, right? I mean, you just press a button and a car comes and picks you up. That's it. Really, in our culture, our expectations have changed as a patient. It's you can barely see it, but Dr. You Are Next waiting room down there in the bottom right is a skeleton. But anyway, our expectations of healthcare have really changed. Healthcare cost has changed. By the end of the decade, it's going to cost nearly $30,000 per family for an employer to provide healthcare for their employees. And patients are increasingly bearing a lot of those costs as well. So this is all in the context of our profession is changing. I am almost 40 years old. So, I was born in 1976, but it's pretty crazy to think that the medical students today were born in 1993. That makes me feel really old. But interestingly enough, Amazon.com was in 1994. So they don't know, the medical students up to date literally have no idea what the world existed like without Amazon. And then these kids that are so used to Uber and Facebook and things like that, they get into the hospital and they see this, right? And they're just like, what the hell? I don't even know how to do that. They're used to this little button that they press and Tide comes along to your door. It's amazing. Or Uber, right? But they're really used to also just having Google and access to information. So are patients, right? Just the concept of Dr. Google being available to you 24/7 is, pretty amazing. It's basically turned us all into first-year medical students, We all have access to the information, and we can all figure out for ourselves maybe what's going on with our body. That's just as revolutionary as the printing press, I think. Well, it's just as revolutionary that people have great ideas, and they have a voice that they can spew out on the internet. I don't know if you saw that twinkle. You see it? Oh, there we go. But Jenny McCarthy said, I think on Oprah, that the University of Google is where I got my degree from, right? And now she puts this information out into the public, and it has real consequences. You can see the spread of vaccine-preventable diseases across the world is significant. And as doctors, that's really what we're competing against. How do we figure out ways to connect with people to let them know that not all of this information is right? And if we don't really do that, I think we're going to become a little bit completely irrelevant as doctors. We have to create our own voice, and it is true we're not going to go away, of course. We're always going to be doing tests, and we're always going to be doing exam visits and things like that.